The good thing about our spine center is that we're focused entirely on the spine. It's all we do.
We created a way for a patient to be evaluated from every possible angle, surgical and non-surgical.
When somebody comes to see a specialist, we have many options on where to refer the patient.
Then it starts getting better. And then when you realize you don't have this anymore, I mean, it was like, oh, this is gone. This is better.
We're built from the day we started on a culture of collaboration. So in our spine center, we're unique, I think in New England, if not in Boston. We have neurosurgeons, orthopedic spine surgeons, anesthesia pain specialists, physical medicine and rehabilitation doctors. We've teamed up with therapists here. So we can give you basically the full breadth of spine care in one unit.
The goal is to allow the patient to see the practitioner that's most appropriate for them the first time to help relieve their symptoms as quickly as possible.
The best information is still the patient's story.
My problem started and my arm was aching. It was aching constantly. And then I was getting the tingling in all my fingers, all of them. This never went away. It was always there. It hurt. It always hurt. It was almost, it made you in tears.
I still think the personal contact with the patient, the physician laying hands on the patient, and not just looking at the films or at the report from a radiologist is critical on the decision-making process.
Where's your pain? When does it get worse? When does it get better? What's it feel like? Those kind of questions are everything.
I asked a lot of questions. Did I do something that this came about? No. Is there anything else I can do? Anything else? No, you've done it.
Some patients are interested in lots of different types of information. Other patients have very specific questions that they want addressed. Everyone is interested in having their problem solved, whatever is causing their pain or their difficulty.
And I'm not that young to begin with, but I have years left that I don't want to suffer. I don't want to be in any more pain than I have. I have grandchildren. I have kids. I have friends. I have a life.
What does the patient expect? What's important to them? What activity can't they do that they want to do? These things are very important and often not discussed, and I think they're focused on it in our spine center.
I thought it was sciatica or just something that you get over, get by, and it was getting worse rather than better over time. The pain was so bad and it was so hard to do things. It was very limiting. It's very nice to have everyone doing everything, but not because you can't do it. So it even hurt to drive. My husband and I have our own business, so I have to, physically sit and do paperwork, computer work, sit and talk on the phone, but I also have to get out and do things. I had a neurosurgeon I went to see, but I was not ready for surgery. I was told I was a perfect candidate, but it just scared me to death.
One common thing that I think is very useful for all patients to have established is to give them a very good sense of what the expectation of the treatment is. For some patients, the expectation may be that their pain will be completely resolved. For other patients, that may not be realistic. And I think it's very important for patients to have the opportunity to be educated in what a reasonable expectation actually is.
It took some convincing because it's scary when you think of a doctor or anyone going near your spine. It's scary.
I'm trying to go through the MRI findings, the CAT scan findings, the X-ray findings with every patient of mine. You need to try to describe the procedure. You need to show them diagrams or small models of the spine and try to explain to them what you're going to do. You're going to talk to them about complications. You're going to talk to them how much time the surgery would be.
Surgery is really driven by the patient. It's how much pain is a patient having, how much dysfunction. Given that, what are the risks and what are the possible benefits? And that's the discussion.
I went up for the consult at Beth Israel Deaconess, and I knew in the back of my mind, if I liked what I heard, if I thought it was a good fit, then I was going to go ahead and schedule the operation.
The first thing that most people are concerned about is their job. How quickly can they go back to work? And that really depends on what kind of activity they have to do at work. If they're lifting heavy boxes, it's going to be a little bit longer than if they're sitting at a desk. So depending on how supportive the employer is and how many accommodations they can make, that's something they really need to consider ahead of time and make plans. If you don't have somebody around to help, then surgery-proof your house ahead of time, kind of like baby-proofing your house. Go around and move all the heavy things up. Maybe make some frozen dinners, do some cooking before surgery, put them away so you don't have to do a lot of heavy cooking and prep work afterwards. If any of your friends call up and say, can I do anything? Make a list of things that you need done and don't be afraid to ask them for help afterwards. And when somebody calls to say, what can I do? Look at number 1 on the list and hand out the assignments.
My doctor was wonderful. It was step by step. This is what we're going to do. This is how we're going to do it. This should be what your recovery is like. This is what you'll have to do afterwards.
Good morning. Hi, Jackie. How are you? Checking in for surgery.
It was great. Go up, go in, get called. They have someone that will, escort you up to where you need to be, and then they move you on to the next spot, and it's really amazing. Just amazing. Everyone was so pleasant and nice. And again, if anyone had a question, there's an answer. So it was very smooth, very, very smooth.
Generally what I'll tell patients is what you're going to trade in the recovery room is you're going to trade surgical pain for your arm pain. So your arm pain or your leg pain is going to be washed away and significantly improved, and you're going to have the post-surgical pain.
Hurt a lot, but it's okay. It was where they did the surgery.
And that generally resolves in 12 to 24 hours or significantly decreases, and then we increase your mobilization.
It was a totally different kind of pain, and I was up and walking the next day.
I tell patients when I see them in the clinic, if you're not out of bed the day after surgery, I'm going to come kick you. And you don't want that to happen, right?
It was amazing. It was just, I felt I was standing up straight. I felt lighter. It was just amazing. My husband kept going, you okay? You sure okay? I am fine. I'm great. I'm gonna wear out my sneakers. I'm doing so well. It was wonderful.
When you have people coming 6 weeks back to the office, 1 month, 1 year later, and telling you, you know what, I'm a different person, thank you so much, this is the biggest gratification you can get from this job.
It is uncomfortable. Any surgery is not comfortable. But each day was better. Probably the second and third day, probably the worst. Then it starts getting better. And then when you realize you don't have this anymore, it was like, oh, this is gone. This is better.
If this were to happen again, I'd be there in a heartbeat. It's just brought my life back to where it was. So the quality is back in my life. And I'd do it all over again. The relief was that fast and that effective.